Goals of care. Goals of care is somewhat surprising to me, a fairly new concept. The only thing we're saying about goals of care is, why are we doing this treatment? I think a goals of care discussion should happen before you have a hernia operation. It should happen before you have a heart transplant. It should happen before you take antibiotics for a sore throat. It doesn't always. GPs are better at doing goals of care. Surgeons are awful at doing goals of care. But goals of care is foundation for palliative care. Why are we doing the treatment? And what are we aiming for? Because it's not always extending life. So goals of care will change over the trajectory. They might include, early on, maintaining and improving function, staying in control. You often see that early on in a diagnosis of a life-threatening illness. Relief of suffering. Prolonged life might be a goal of care. Often it's for a specific time. You know, I just want to stay alive for my granddaughter to be born. I'm sure you've heard stuff like that. Quality of life and living well. Pain and symptom management is pretty high up there. Relieving burden for family members, strengthening relationships, preference for location of care. You hear that a lot. Preference for location of death. I actually hear that less so. Life closure, dying well, and personal wishes for management of dying. These are just examples. I'd like you to think about them, because unless you've asked those questions, well, where do you want to die? What's important to you? We know that your life is probably going to be limited by this illness. What's the most important thing to you? Unless you ask those questions, how can you possibly do a good assessment? Because we don't know what we're trying to treat. So goals of care should come up in any palliative care assessment. So just summarizing it, it should be quality of living in the context of a life-threatening illness, and quality of dying in the midst of life.